Hello everyone. Let's log into the care portal using an admin account. You can log in using a personal account which has different levels of access, like the administrators or site staff, or using your organization's software or setup if you get permissions from your system, which makes it a single sign-on. I'm currently using my personal account. We need to go through the multi-factor authentication. Now you're taken to the task list. The task list shows a summary bar which shows the total number of tasks, new tasks this week, the number of patients with reported risk, and the task breakdown for the HCPs to review. The task list is where the doctor or nurse or care team goes and reviews the patient submissions in order to make decisions. This is where you review the submissions from patients. It can be symptom reviews, test results, or other types of questionnaires, which depends on the program's needs. Let's go to the patient list. The patient list is a consolidated view of all the patients under this organization for this site. You can search, sort, or filter patients based on multiple factors. Let's go and add a patient. You need to select a site. The patient ID would be the NHS ID. Patient's date of birth. The patient has to be at least 18 years of age. The treating HCP needs to be selected. The invitation language. You need to provide either an email address or a phone number to get the invitation email. Adding a note is optional. You need to select the primary diagnosis type, a subtype, the current stage or status of the cancer, the treatment regimen that the patient is currently on or was. We have a few more parameters here. The start date is mandatory. Let's save it and submit it. Once we submit it, we see the patient instruction form. This is the registration code which is unique to this program, and this is the NHS ID that we just entered. The profile currently looks like this. It shows that the status of the patient is in screening. You see the date of birth and some information that we just filled in. Let's go to the app and sign up.
Now let's see how the user will utilize the app to manage their health and condition as part of the program. After being screened on the care portal, the user will receive a set of instructions from their SCP, which contains the patient ID and the registration code. They can use those to sign up on the app by clicking over here. For this demo, we are going to log into one of the test accounts that we have. After the user onboards and logs into the app, they come across this home page where they can track their in-app notifications, their condition, their mood, symptoms, daily stats, which is a combination of different activities like sleep, steps, bowel movements, and so on, and also their medications. Let's log some symptoms. After logging symptoms, if there is an associated syndicated insights also appear on this in-app notification over here. They can click on Learn More to view more about the symptoms. This can be customized as per the need of the program, so we can also insert our custom links. Over here on the medications, we can see the scheduled medications. We can click on one of these and then save, which logs their medication for this time. Over here on the bottom page, we also have calendar, which shows all their logged activities, also their schedule, reminders, and medications. The user can log various activities within the app, such as blood glucose, blood pressure, heart rate, physical activity, and also mindfulness. On the insights page, the user can also view their different correlated insights, which is based on the logging behavior of the user. For the program users, we have a dedicated section called My Care within the app where the user can view their pending, new, and completed action items, their health records, their treatment plans. We also have various resources for the programs, and these resources can be customized as per the need of the program. We can also add different sections on this page, but currently we have medication information and the log test results. Here the users can view and access their test results from this section. Now let's go back to the care portal to see how it looks for the SCP, the staff, and the nurses.
Let's now go to one of the patients which has some data. We see that this patient is active. Let's go to the patient profile. The patient profile shows that the user is active. We see multiple other factors like the symptoms that were reported by this patient recently, the program updates of this patient, and the compliance. We see a task list specific to this patient where you see the tasks that are completed, reviewed, or not reviewed. We have the treatment plan tab where we can edit the patient information. We also have the trends. The medication adherence tab shows if the medications have been taken or not. As the patient submits information to our platform, we see how the treatment plan is going for this patient with the help of these graphs. So we have the PSA level, the ALP, the testosterone level, the weekly symptom review, and some other surveys like IIF, IPSS, liaison score. We can also customize this based on the program's needs. If the patient submits their PSA levels or if the care team submits the patient's PSA levels themselves, our application can display the PSA doubling time over the last few months. And similarly for ALP, testosterone, and some other surveys, we see the test values here, and we see the slope, the velocity, and the graph, which makes it better to visualize. This is the IIEF survey graph, the IPSS survey graph, the table.
Coming back to the app, let's see how the action item looks for the user. This is the combination of different surveys and test results that is required by the NORS or the SCP for the user to be completed. The user can view the to-do and completed action items in this section. They can go to any of their submissions and then view their past records. Let's go to the weekly symptom review. So this survey is about users' experience and symptoms over the past 7 days. Right now it's scheduled to come in every Saturdays and it's once per week. The first question is about different severities of the symptom that the user experienced over the past week. Based on this severity, there will be follow-up and additional questions in the survey. Here we are seeing the skin issues question because we selected some level of severity on our first question. There are different single choice questions and multiple choice questions on this survey. And over here we have a pain body map where the user can indicate their pain levels throughout the body. The user can also go back to change any of their answers. Now let's submit this survey. The survey has been submitted and the report for that survey will appear over here on the reports.
Let's go to the task list and review a weekly symptom review. Let's go to one of these. The task list arranges the weekly symptom reviews and other tasks based on the risk indicators and the latest ones that need to be reviewed. This is how the PDF report looks that the patient just submitted. We can select multiple follow-up options like advising a patient, requesting a patient update, logging an internal action by the HCPs or the care team, or no further action needed. Let's select advise a patient. We can select a reason. Let's say schedule a follow-up visit, a message to the patient which they will see on the app, an internal note that's optional, and you need to select if you contacted the patient while reviewing this report. We also see the cohorts that the patient is in and the risk indicator and also the past care team interactions if it has any. Now let's submit this follow-up. We also see the reviewed status. Now let's see this in the app.
Once the WSI is reviewed and there are some comments left on the report by the SCP or the doctor or the nurse, they will show up on home screen on the in-app notifications. Here we can see the new message from the care team. The user can click on this view now to see the message, and here you can see the message. Now let's go back to the My Care menu and log a PSA test result. The user can see their previously logged test result over here. We can click on this and then add a new one. Let's select the date and time, the PSA level, and then for the actual test report we can either add pictures or files. They can either take a photo or choose from their gallery. For this demo, let's add it from the gallery. Here we are adding 3 pages of our reports. We can also drag and then change the order of these reports, or we can simply remove any of the pages and add new pages. Let's save this PSA. Now this will show up over here as the latest log. And we can also go back to this My Health section to see how it looks on the graph.
Let's now go to the staff list. The staff list again shows the staff under this organization for this site. We can add a staff. Need to write the first name, last name, the user type, which can be either an admin or a site staff, the language that you want staff to be in, the role, the site, email address to get the invitation. Let's create the account and send the invite. Let's go and view the profile of this user. We see all the details that we just filled in and that the status of the account is active. Now this is where I get an email with the invitation. We need to use this route to log in and sign up into the care portal. Let's log out from my earlier account. Let's follow these instructions. We also have a temporary password. Enter the username. Now it prompts us to reset the password. Password needs to meet the below given categories. We're done resetting the password. Now we need to set up the multi-factor authentication. I'll set it up using my email. Should have gotten a code. We can save the recovery codes and log in. We are again taken to the task list. Let's now go to the resources. The resources are helpful for all the program needs, and these can be customized. We can also save them. And these are deep links, so you can customize them based on the program. You can go to the saved ones and see the ones that we are saved. The activity logs are something that we see the activity of the other staff users. We can also see our own profile and edit it. And we can also change the password and manage the multi-factor authentication from this tab. Thank you.